So in looking at the medications that we might want to cease, first thing I like to think about is the ones that are high risk and the ones that are low benefit. And in both of those situations, there are certain patients where they are even more risky and there are ones that are even less benefit. So looking at this guy, for example, 94 years old, on his 16 or so different medications, we know that anti-hyperglycemics can be high risk in older, frail patients, and we know something like a statin might be low benefit in a very old patient who's previously had some issues. So that would be probably where I'd start, particularly those sort of preventative agents. Yeah.
No, I agree. And once you've picked off the outliers, so to speak, then you need to look at the other tablets in detail and say, well, look, what's the indication for this medication? Has the patient's situation changed so that it's more risky than it was when it was first prescribed? Has what you're trying to prevent changed so it's less important now than it was? And probably the analogy I might use there is somebody with fairly advanced cancer and you're looking at medications to try and prevent a heart attack and a stroke. Are these really important anymore?
Yeah. The other one is, people that have symptoms, they might have had symptoms for a long time, started on medication for them and just continue on the medication even though their symptoms may well have improved or changed, or the cause of those symptoms has since disappeared.
We see that with a lot of conditions, don't we, like reflux and pain, insomnia.
Yeah, they often can't sleep. They go on their tablets, they can sleep, then they can't sleep, but they're still on their tablets. Yeah. And there are medications that we know are just high risk in everyone. The Beers criteria, or the anticoagulants, the opioids, the ones we try and sort of minimise in lots of people, and so on.
Or things like digoxin, where there may be a narrow therapeutic index in terms of effectiveness and toxicity, and somebody's lost a lot of weight or their renal function's declined, and suddenly the appropriate dose 5 years ago is now a toxic dose and causing significant problems in its own right.
Yeah, totally agree.